During this segment, we'll tell you just about everything you need to know about the colonoscopy exam, one of the most important routine procedures recommended for everyone. You'll learn about the reasons why and when you must put a colonoscopy exam on your list of priorities. We'll talk about the two most frequently used preparation methods for the exam, and you'll hear the details about what to expect during and after the procedure.
I'm Dr. Sobrado. I am a gastroenterologist. I was trained in Tulane University in 1985, and I served the community by providing services in my office as a private physician, affiliated with the Baptist Healthcare System and Kendall Regional Hospital and Palmetto.
Hi, I'm Marin. I went to the University of Miami for medical school, after which I went to Emory University for internal medicine and USF Tampa for gastroenterology.
Did you know that a colonoscopy exam could save your life? Simply put, a colonoscopy is nothing more than an exploration of the rectum and the intestines. But this exam can detect a variety of medical conditions. Among them, polyps are the most common, some of which could be or could become cancerous. The exam can also detect diverticulitis and ulcers, among other conditions.
The most important diagnostic test that we perform is colonoscopy, which is a preventive test for colon cancer. Well, colon cancer is a very important cause of morbidity and mortality in this country. In this country, the second leading cause of death in women and male, over 150,000 new cases of colon cancer are diagnosed every year.
Colon cancer is the second leading cause of cancer deaths in the United States. 1 in 20 people will have colon cancer. This exam decreases your risk of colon cancer by 70%.
The colonoscopy is recommended for everyone at the age of 50, regardless of gender. At a younger age, if there is a family history of colon cancer or certain symptoms in the digestive system, such as irregularity or changes in your digestion, drastic weight loss, or rectal bleeding, among other symptoms. By far, the most critical aspect of a colonoscopy exam is the preparation that you must do before your procedure.
Colonoscopy is a diagnostic test in which we need to examine your intestines from the inside. Therefore, the colon has to be clean. And for the laxative, there are different preparations out there.
There are many prep medications or laxatives available. You'll have choices based on your preference, insurance coverage, or doctor's recommendation. During this segment, we'll explain the simple steps you must follow when using two of the most frequently used preparation methods. One is called Suprep. This method contains 2 small bottles of a laxative, which must be mixed with water.
You have to understand that you have to get yourself ready for the test. And to get ready, the office is going to give you a specific recommendation on a diet.
The day before the colonoscopy, you will need to do a preparation, a clear liquid diet as well as a laxative.
Starting at 4 in the afternoon of the day prior to your procedure, pour one of the bottles into the plastic cup provided. Fill it with fresh water up to the 16-ounce line marked on the cup. Mix it well and drink it all. During the next hour, you must drink at least 32 more ounces of water or clear liquids. Repeat the exact same process with the second bottle of medication provided, starting at 8 o'clock that evening. Another preparation method that is widely used is commonly known as the gallon. For this method, you'll need to fill the container with fresh water up to the maximum liquid line and mix it well. Begin drinking the solution at 4 in the afternoon of the day prior to the procedure, accompanied by plenty of water or clear liquids. You must finish drinking the solution by 9 o'clock that evening. Regardless of the preparation method that you use, you may not drink or eat after midnight. As with most cases, the morning of the procedure, the worst is most likely over.
Good morning.
After a brief admission process, checkup, and preparation, your doctor and medical assistants will be available to discuss any concerns you may still have. The procedure usually takes 20 to 25 minutes depending on whether any polyps are found.
The day of your colonoscopy, you will not feel a thing. You'll receive sedation that will prevent you from feeling any pain or discomfort.
You will need someone to drive you home, although you'll be fully alert after recovery. You may not drive due to the sedative that is administered during the procedure.
And after half an hour to an hour recovery, you're going to be able to stand up.
A few minutes later, you will meet with the doctor once again to briefly go over the results of the exam. Gastromed, committed to your health.